Hey YouTube friends, disc problems in the lower back are super common and often they can be a cause for lower back pain. If you've ever been to the doctor and had an MRI, or there's other imaging scans as well that can see a herniated disc problem in the lower back, then there's a chance that your back pain could be coming from this herniated disc issue. And the concern with it is that if it doesn't get better, it can begin to pinch on a nerve or end up requiring some sort of surgery, possibly even the type of surgery where they put in screws and pins and metal hardware in the back. And the good news is that it can be avoided. So I'm going to cover with you today 2 exercises that you can do to begin to help a herniated disc problem and reduce the pain that you might have from this herniated disc problem. So here are the 2 exercises. The first one is a knees to chest exercise. Now it sounds pretty straightforward. You just pull your knees to chest, but there's a few little things that I want you to be concerned about so that you can get the most benefit out of taking pressure off your discs so that you can feel better right now and begin to allow that disc to heal so that you can end up avoiding surgery and having to visit the doctor for injections and pain medications. So let's have you go ahead and pull your knees to your chest. You might need to slowly do it. He moves really fast. If you're having a back pain problem, it's going to be really slow. But you're going to hold on with your hands here pretty well so that your knees don't just fall away from your body. And I want you to pull those knees in as tight as you can comfortably, simultaneously while you're holding those knees in with your lower back. Push that back down as hard as you can. You saw him lifting his head and shoulders a bit. The reason why that happens is because when you push down right here, your abs turn on, the abdominal muscles turn on. So you're taking advantage of 2 things here. Just pulling your knees to your chest takes some pressure off the discs, but turning on your abs at the same time takes even more pressure off the discs. It's a bit of an exercise. You can see I'm starting to shake a little bit there. So take breaks as needed. Go ahead and take a break here. And what you'll have to do is hold this anywhere from 10 to 30 seconds or more, really as long as you can comfortably endure, but without making the back problem any worse. So you have to find the sweet spot as far as how hard to pull with your hands and how hard to push your back down. But show them one more time here. So you're going to bring your knees up, pull them in really hard, push that back flat, and that might lift up your head and shoulders, and then you're just going to hold it there for a while. Now a good time length to repeat this exercise would be about 3 to 5 minutes. That should be enough time to give you some relief, and take breaks as needed, like I said. Go ahead and take a break there. The second exercise that we commonly give our clients that are suffering from a herniated disc problem in their lower back is a bridge exercise. Now, a lot of people do this one as well, but there's small differences that I want you to take note of so that we can maximize the pressure off the back. Now, let's show you a bad bridge first. So go ahead and just pick up your hips as high as you can, not worrying about anything. This type of bridge, without worrying about what muscles you're firing, is going to tend to make the lower back arc a lot, which can actually put way more pressure on the disc. So let's do it a little bit different. Go ahead and come on down. Before you even come up, just like we did with the knees to chest, flatten out that low back as hard as you can. Head and shoulders might come up a bit. Your abs are already going to be working if you're doing this just right. Now before you even lift, squeeze those butt muscles, tighten up the glutes. Now holding the back flat and the butt tight, then begin to lift and just lift a little bit. Like that's it. Stop right there, hold. Abs should be working, butt muscles should be working, and you might be like this high off the bed or the floor wherever you're doing this. You might even barely even lift. Some people don't even lift and they already feel the right muscles working. Take a break, so do this for 10 seconds, and then take a little break. You can hold for longer, 15, 20, 30 seconds if you want. And the point here, what you should feel is hardly anything on your lower back. Maybe a little bit of muscle stretching or tightening, but it shouldn't be painful. It shouldn't be aggressive on the lower back at all. Where it should be aggressive is on those butt muscles and likely the ab muscles as well. So if you're doing this right, you should engage the abs first. Go ahead and push your back down here. Abs are going to fire right there. Then squeeze the butt muscles. And you're going as hard as you can without any pain or discomfort besides muscles working. Then lift up just a little bit. No need to go higher than that at this point because then you do start to put more pressure on the discs. And if you have a freshly irritated disc problem, it's just not going to be a good idea to go up any higher at this point. And then come back down there. So you would do this, repeat it for about 3 to 5 minutes, and repeat these exercises throughout the day. This could be the difference between you going to the doctor today or not. And if you have some success with this, then you might be able to avoid that injection, avoid that pain medication. And if you begin to resolve this problem for the long term, then you can potentially avoid that surgery so that your disc is healing and not getting worse as time goes on. Thanks for watching, YouTube friends. I hope that this video was helpful for you, and if you're out there dealing with a back problem right now, I hope that you're getting some relief and you're putting down the phone that you were going to use to call the doctor about getting an injection or some pain medication today. And I just want you to realize that this is just step one that we give our patients. There's many more steps beyond this, and our patients that we see in the clinic typically progress well beyond these easier exercises. They get into the harder stuff so that they can eventually prevent a surgery and prevent the problem from coming back for the long term. So just bear that in mind. I wouldn't expect you to do these exercises indefinitely and fully correct a herniated disc problem. But if you found that this video was helpful for you right now, then I encourage you to hit the like button below here. And if you want to learn more exercises and other tips about back problems and other health conditions, hit the subscribe button just a little bit over. If you're looking for even more tips and videos that we already have, I encourage you to go over to our channel page and find the playlist that's full of back pain videos, back exercises, back tips, and you'll get tons of extra information about how to help your specific back problem. I hope that you have a wonderful day. Bye-bye.